Okay, hello everyone. Welcome to the session on Unacademy on 30 minutes, 30 images. So we are back. You all know that 8:15 p.m. every day we are having these sessions. Those who are coming to it for the first time, welcome. Those who have been coming every day, we are going to be continuing this for the rest of this month. So 30 minutes and 30 images. So today we are going to do dermatology. Okay. So welcome to Unacademy. The Plus subscription will give you access to both live and recorded classes, and you learn from India's top educators for your medical exams. We also have a question bank and printed notes in the Plus subscription. We have the iconic subscription along with prep ladder. Then we have the batches that have started, Focus FMG batch, and the Target Next 2022 batch. So Focus FMG batch is for December FMG students, Target Next 2022 for next year students, NEET PG test and analysis batch, and Ultra Fast Track High Yield Revision batch. So guys, remember these two batches, NEET PG test and analysis and Ultra Fast Track High Yield topic revision. This is for those who are giving the exam next month on September 11th. So there's going to be a quick revision of all 19 subjects, and we also have 12 grand tests for them, and you can get all of these three things, access to these two batches plus all these grand tests, just for 6750 rupees in a 2-month subscription. On top of this, you can use my code Dr.Jhanvi Life and get extra 10% off on this subscription. So we have a lot of offers on subscription. The iconic subscription offer is now over. The price hike has already started from today. So this is the Dr. Jhanvi Life code that will give you 10% off on your subscription. All right, so let's begin with our class for today before further ado. So this is our first picture for today. Can anyone identify what is this exactly? Very good, Priyang, absolutely correct. This is seborrheic dermatitis. What is it commonly called? Seborrheic dermatitis. I just chose the circle mode. Is it not okay for you guys? Then I can change it. I can make it into the square mode also, whatever you all want. Okay, yes, seborrheic dermatitis is also commonly called as dandruff. It's too small. Okay, right now in the middle of the class I can't change it, but from next class I'll change it. Okay, all right. So seborrheic. Now the question that comes about seborrheic dermatitis is you have to tell me that it is what? It is exfoliation of one of the layers of the epidermis. So which layer of the epidermis, when it exfoliates, do you get seborrheic dermatitis? Yes, absolutely correct. It is stratum corneum. Okay, this is the question that comes in the exam. What layer exfoliates to give you seborrheic dermatitis? Okay, all right. Next question. So now we have all the layers of our skin over here. So starting off from 1, 2, 3, 4, 5, 6, and 7. Tell me what is all of this? What is layer number 1? We'll go from layer number 1 onwards. Yes, so we are talking about epidermis. So first is stratum corneum. Okay, main cell in stratum corneum. Main cell in stratum corneum is the keratinocytes. Very good. Okay, then after that, what is number 2 over here? Yes, so number 2 over here. So if you see, actually stratum corneum is this whole layer, okay, which is marked as 1 and 2. Number 3 over here is your stratum lucidum. Now stratum lucidum is present in 2 areas. Can you tell me in which areas is stratum lucidum present? Stratum lucidum is present in palms and soles. Absolutely correct. What is number 4 that is marked over here? This layer, number 4. Yes, so number 4 is stratum granulosum. And number 5 over here, that you can see all these individual cells over here, it is stratum spinosum. What is the other name of stratum spinosum? Anyone? Stratum spinosum is also commonly called as prickle cell layer. Absolutely correct. Okay. And what is the special thing about stratum spinosum? What is the special thing present in stratum spinosum? Between the cells. Yes, between the cells it is desmosomes. Okay, the intercell connection. ऐसा cell होता है तो intercell connection, that is the desmosomes. What is number 6 over here? This layer. Layer number 6, that is stratum basale. Absolutely correct. And layer number 7 is your dermis. Correct? All right. Now, let's come to a few questions about this. So tell me, your epidermis is made up of what type of epithelium? Your epidermis is derived from... Yes, so it is derived from stratified squamous epithelium. Absolutely correct. So next question for you guys is, now you have to tell me all these things are present in which layer of the epidermis or dermis. Elidine granules, they are present in which layer of the epidermis? Tell me. Yes, so your elidine granules are present in stratum lucidum. All right, next one, Odland bodies. Odland bodies are present in... Odland bodies are present in stratum granulosum. Very good. Then next question. What is the thickest layer in the epidermis? So without looking at the picture, tell me what is the thickest layer in the epidermis? Yes, so if you see over here, this is the thickest layer of the epidermis, and that is your stratum spinosum. Okay. Then the Malpighian layer. When you say Malpighian layer, this Malpighian layer is made up of which two layers? Yes, so Malpighian layer is made up of stratum spinosum plus stratum basale. Okay. Now, what are the projections of dermis into epidermis called as? Projections of dermis into epidermis. What are they called as? Are you sure it is called rete ridges? This is where most of you all go wrong. Projections of dermis into epidermis. Yes, very good. Projections of dermis into epidermis are called as dermal papillae. Uska ulta, opposite batao, projection of epidermis into dermis. What is that called as? Yes, that is called as rete ridges. Absolutely correct. Now tell me, maximum melanocytes are present in which layer? It is present in stratum basale. Very good. Next question for you guys. Burbeck granules are present in which body? Burbeck granules are a specialty of which body? Langerhans cell. What is the work of Langerhans cell? What is the work of Langerhans cells? Yes, they are antigen presenting cells present in the skin. Okay. Next, your Merkel cells. What are they? What is the use of Merkel cells and in which layer are they present? Yes, they are mechanoreceptors or touch receptors. Absolutely correct. And they are present in which layer? Merkel cells are present in which layer? Okay, is it in spinosum or basale? I can see many of you all are getting confused. Okay, your mechanoreceptors are present in basale. Now tell me, what is the marker for Merkel cells? What 20, Gautaman? CD20 or something else 20? Yes, it is cytokeratin 20. Cytokeratin 20. Okay. Next question. Now, what is, we missed over here, what is the marker for Langerhans cells? Marker for Langerhans cell. CD207. Absolutely correct. Okay. So this is our revision of the layer, and you need to know these important things, which bodies are present in which layer. That is the most important thing. Okay. So this is our revision of all the layers of the epidermis. Now let's go on to the next image. So what are these lines called along which the collagen fibers of the body are arranged? Are they lines of Blaschko or are they lines of Langer? So I'll give you two options, Langer and Blaschko. The lines along which the collagen fibers are arranged. Mark in the poll. Everyone is confused. Okay, so you all saw what is the use of all these classes. Despite you all reading and making sure that you've read it 100 times, you all are still making mistakes in all these things. Okay, so these are called as lines of Langur. Okay, so these are lines along which collagen fibers are arranged, and usually you're supposed to take your incision along the lines of Langur only. So 62% of you have answered it correctly, but 36% have still made a mistake. Okay, now what are these lines called as? Any idea? Yes, so these are your Blaschko's lines. Can anyone tell me what are Blaschko's lines? Yes, they are lines containing melanin, absolutely correct. They are the lines along which embryological development takes place. Okay? Lines along which embryological development takes place. Okay, now these lines, they are filled with melanin and they become very obvious in which disease? Any disease in which the melanin becomes very obvious, it starts pouring out and you can see the Blaschko's lines like you can see in this patient. Yes, it is, these Blaschko's lines are seen in incontinentia pigmenti. Okay, all right, moving on to our next picture. Identify the pattern of hair loss in this patient. Areata, no. Very good. Isleaders, absolutely correct. You can see over here that this is a very bizarre pattern of hair loss. Okay, you can see this is a very bizarre pattern of hair loss. This is not coming out from any one particular area or like areata from patchy areas. This is coming from this one area. Okay, so this is nothing but bizarre pattern of hair loss. It is also commonly called as trichotillomania. Okay, what is the other thing that will tell you that this is trichotillomania, in which they keep removing the hair? The people will keep plucking out their own hair. There will be perifollicular hemorrhages. Okay, so you'll see small hemorrhages over here. Okay, yes, it is a kind of OCD. Whenever the patient is anxious, whenever the patient is scared, they will start plucking out their own hair. Okay, moving on to our next picture. Identify. This is not areata. This is tinea. Very good. This is endothrix and ectothrix infection. Okay, so this is commonly called as Tinea capitis. Now, which type is this picture number 1 and which type is picture number 2 in Tinea capitis? Okay, so can you see black dots over here in picture number 1? So when you see black dots here in picture number 1, this is called as the black dot type of Tinea capitis. And what can you see in 2? In 2, you can see gray patch type of Tinea capitis. Okay, you will see lusterless hair in this area. So this is called as gray patch type of Tinea capitis. Now, can anyone tell me what is the causative organism for black dot Tinea capitis? And give me some examples also. Is it endothrix or is it ectothrix? Endothrix infection or ectothrix? Yes, it is endothrix infection. And some examples of endothrix infection are Tinea violacum and Tinea tonsurans, correct? Okay, now what about number 2, gray patch? In gray patch, what do you see? Yes, in gray patch, Tinea capitis is caused by ectothrix. Okay, ectothrix infection. Now, example of ectothrix is Microsporum species. Okay, all right. Moving on to our next picture. Very good. Moth-eaten alopecia. This is moth-eaten alopecia, and you see this moth-eaten alopecia in which disease? Syphilis. Just don't write syphilis. Which type of syphilis? Primary, secondary, tertiary? Yes, it is seen in secondary syphilis. Moth-eaten alopecia. Can you tell me the other dermatological manifestations of secondary syphilis? Lot of disturbance in sound. What disturbance in sound are you getting? Yes. So condyloma lata. That is one of the condyloma lata. Anything else? Secondary syphilis? Okay, all right. So now let's move on to our next picture. What is this pattern of hair loss that you can see? And I will give you an example. They will give you a case-based scenario. The patient has recently had chemotherapy and she has started losing hair. So identify the pattern of hair loss in this patient. Yes, very good. So this is commonly called as anagen effluvium. It's not telogen effluvium. This is anagen effluvium. So what is happening? Because of the chemotherapy, the hair is getting arrested in the growth phase. Okay, so what is the growth phase of the hair? Growth phase of the hair is anagen phase. Okay, so hair is getting arrested in the anagen phase or in the growth phase because of chemotherapy. All right. Okay, next one they will tell you, this is a patient who has recently had typhoid infection and she is having hair loss, or more common they'll say postpartum hair loss. So can anyone explain postpartum hair loss? What is the diagnosis in this case? Yes, absolutely correct. So it is telogen effluvium. Okay, telogen is anyways the phase in which the hair is going to get lost. So what happens is that whenever someone has any kind of stressor, infection, pregnancy, the hair starts entering into the telogen phase prematurely. Okay, so as a result of this, you will always see the question will come like this. There is an infection and 3 months after the infection, the patient is having excessive hair loss. So what is the reason for this? The reason for this is telogen effluvium. Absolutely correct. Okay. Now, next question for you guys. This one, identify the difference between female and male pattern hair loss. These are examples of female and male androgenetic alopecia. You need to tell me what are the main differences between the two of them. Okay, very good. So in male, you can see that there is temporal recession of hair. That is the first thing. In the temporal areas, you can see that the hair is getting lost. So here in the temporal areas, hair is getting lost. Okay. And what is the second thing that you can see? Central hair loss that you can see in the male. Okay. In females, where is the hair loss? Yes. So when you see in males, you have temporal baldness and you have hair loss over the vertex. Okay, vertex of the skull. Now in females, you will see central thinning of hair. So there won't be any temporal balding, there won't be any vertex hair loss, but there will be central thinning of hair. Okay, can anyone tell me the classification or the grades of female alopecia, female androgenetic alopecia? What is the classification called as? Very good. So the classification is called as Ludwig's classification. You don't need to know the grades, but you just need to know the name of the classification. Okay. All right. Moving on to our next image. Identify the type of alopecia and what condition do you see this alopecia in? Very good, Kiran. Absolutely correct. This type is seen in discoid lupus erythematosus. But can you tell me what is the name of this alopecia called as? Very good, Aruba. This is called as scarring alopecia. Scarring alopecia, and you can see coin-shaped lesions in the scalp. So these coin-shaped lesions are typically seen in scarring alopecia caused by DLE. Now DLE का coin-shaped lesions में बीच में you will have telangiectasia and side में you will have rolled out edges, and that is usually seen in the face or the neck. Okay, and in the scalp when it is seen, this is scarring alopecia. All right. Now you can see the hair follicles. They are surrounded by these bluish gray patches. So can you tell me these bluish gray patches around the hair follicles are seen in which disease? Perifollicular blue-gray discoloration. Seen in? Very good. So they are seen in lichen planus. Okay. Now some of you are saying alopecia areata. Alopecia areata is also correct. It's not wrong. Alopecia areata is commonly seen in lichen planus. So the answer can be both of them. But if they give you lichen planus, then that is a more correct answer. Okay. All right. Next one over here. What is the skin condition that you see in this patient? Pediculosis, no. Okay, let me tell you, this person has been playing out. He's been playing cricket out in the summer every day. Every day. Yes, very good. He's been playing out in the summer every day. So this is Miliaria. Okay, this is Miliaria rubra. Now, I want to ask you guys one question. I always ask you about Miliaria. I know this is not looking like a full-blown Miliaria, but you have to tell me there are 3 types of Miliaria depending on the blockage of the eccrine glands. Okay. So tell me, when the eccrine glands are blocked in stratum corneum, what is that kind of Miliaria called as? When it's blocked in stratum spinosum, what is it called? And when it is blocked at the dermo-epidermal junction, what is it called? Okay, so what is it called? Yes, so Miliaria crystallina is when it is blocked in the stratum corneum. C for corneum, C for crystallina. Okay, in the stratum spinosum, when it is blocked, it is called as Miliaria rubra. And when the eccrine glands are blocked in the dermo-epidermal junction, then it is called as Miliaria profunda. Very good. Okay, very good. All right, moving on to our next picture over here. So what is this? Apocrine miliaria, very good. No, it is not hidradenitis suppurativa. This is apocrine miliaria, and it is also commonly called as what? Apocrine miliaria is commonly called as Foxfordyceous disease or spots. Is it called as Foxfordyceous disease or Foxfordyceous spots? Yes, it is called as Foxfordyceous disease. This is not a normal thing to happen. Sorry, it is due to blockage of the apocrine glands. Okay. All right. Now tell me, if there is colored sweat, what is that called as? Colored sweat and foul smelling sweat. Yes, colored sweat is called as chromohidrosis. Okay. And foul smelling sweat is commonly called as bromohidrosis. Very good. All right, moving on to our next image over here. So what can you diagnose? You can see reddish nodules. Then it can also be present in the form of scarring, bridges, and sinuses. So what are we talking about over here? Yes, absolutely correct. These 3 things are seen in which condition? It will start off as small erythematous nodules. It can become into discharging sinuses, and later on it can become into bridging scars also. So these 3 things are seen in hidradenitis suppurativa. Hidradenitis suppurativa. Can anyone tell me the pathological reason behind it? What is getting blocked in hidradenitis suppurativa? Very good. The pilosebaceous glands which supply the hair follicle. Okay. So the pilosebaceous glands which supply the hair follicles are getting blocked in this case. Very good. Now, can anyone tell me what are the name of these glands? This is a picture of the breast along the areola. And what are the name of these glands? Okay. So what are these? These are all kinds of ectopic sebaceous glands. Okay, all kinds of ectopic sebaceous glands. So over here, the first one that we see around the lip is nothing but your Foxfordyceous spots. Now this is not disease, this is Foxfordyceous spots. Okay, and what are these around the areola? Yes, very good, Sankeet. So around the areola, they are called as Montgomery glands. All of these are examples of ectopic sebaceous glands. Okay, so these are called as Montgomery glands. All right. Now, next, I'm telling you this is around the penis. So around the penis, the ectopic sebaceous glands are called as Tyson's gland. Very good. They are typically under the prepuce. Okay, Tyson's glands. And around the eyelid, what is the name of these ectopic sebaceous glands called as? Very good. So around the eyelid, they are called as meibomian glands. Okay, meibomian glands. All right. Moving on to the next picture. Identify this instrument used in dermatology. Very good. So this is Wood's lamp. This is Wood's lamp. Now about Wood's lamp, you need to tell me what is the ultraviolet light that of what wavelength ultraviolet light does Wood lamp give out? 360 to 364 nanometer. Absolutely correct. 360 to 364 nanometer. Okay. And the filter of Wood's lamp is made up of what? This is made up of barium silicate. Absolutely correct. It can be made up of nickel also, but in most of the cases, it is made up of barium silicate. Okay. Now, let's answer this. This is an important thing about Wood's lamp. Okay, I'll just move my head out of the way. So tell me, what is the color under Wood's lamp of Pityriaceous versicolor? Under Wood's lamp examination, Pityriaceous versicolor looks golden yellow fluorescence. Very good. Okay. Next, about microsporum. Microsporum looks what color under Pityriaceous versicolor? Green apple? No. Okay. It is blue-green fluorescence. Okay. Next, trichophyton. Trichophyton color under Pityriaceous versicolor? Dull blue. Very good. And what about erythrasma? Erythrasma patches will be seen as coral red. Okay, easy to remember because erythrasma, anything erythri means red. Okay, so erythrasma patches are coral red in color. Absolutely correct. Erythrasma is caused because of what organism, guys? Coral red. You can remember like this: coral red, Corynebacterium. Okay, coral red and Corynebacterium minutism. Absolutely correct. Okay, next one. Identify the mode of examination and identify the organism that is shown in this. First one, pehle wala batao and second wala batao. I think second wala most of you all have understood it very easily. These are copper penny bodies. They are also commonly called as medlar bodies. So these are seen in which condition? Copper penny bodies or medlar bodies commonly seen in which condition? Yes, they are seen in chromoblastomycosis. And what about picture number 1? Picture number 1 over here, what is this appearance called? Yes, not sporothrix. This is your spaghetti and meatball appearance. Okay, you can see chota spaghetti and meatball appearance. Whoever has eaten spaghetti and meatball only will probably be able to diagnose this quickly. Okay, this spaghetti and meatball appearance is seen with what organism? With Pityriaceous versicolor or Malassezia furfur. Okay, it's seen in Pityriaceous versicolor. Absolutely correct. Now tell me, what is the examination status? What is this test that we are doing over here? Yes, it is a 10% KOH mount. And this is used for identifying what? It is used for identifying fungi. Okay, this is your 10% KOH used for identifying fungi. All right. Now, this is your Zanck smear in which you are seeing multinucleated giant cell. Identify which infection has happened to the patient. HSV. Okay, something more. Yes, so it is actually seen in varicella zoster infection. Okay, so absolutely correct. Varicella zoster infection, VZV may, you will see Zanck smear showing a multinucleated giant cell. Now, this is another Zanck smear. What can you see in this and identify the disease? Zanck smear दो ही जगह पे use करते हैं. Okay, you can see that there is a round nucleus and surrounded by a perinuclear halo. Round nucleus surrounded by perinuclear halo that is seen in Zanck cells, typically called as Zanck cells seen in pemphigus. Okay. All right. Next question. This is something which you all must have probably eaten ice cream of, and we also use this in dermatology. So can you tell me what is this? Yes, absolutely correct. This is liquid nitrogen. Okay. Why do we use this in dermatology? Liquid nitrogen, any idea? It is used for fixing tissues. Okay, it is used for fixing tissues onto slides, especially those of warts. Okay, absolutely correct. Okay, next picture. Identify picture A and identify picture B. Many of you all must be having it. I have them all over my nose. Yes, these are comedones. These are the starting point of acne. This is called as comedones. Now you have to tell me A is open or closed comedone. So I will put a poll. Option A is open, option B is closed. So A is open comedone or closed comedone? Okay, very good. 80% of you have answered correctly. So this is open comedones. Okay, how do I remember? Open comedones may all the dust will come and settle outside. Okay, so it will look black because of the dust. So these are our open comedones, and the white ones which are coming from inside are called as closed comedones. Okay, so we have open comedones and we have closed comedones. Okay, now next question that I have for you guys is, what are the grades of acne? So tell me, in grade 1 what do you see, grade 2 what do you see, grade 3 what do you see, and grade 4 what do you see? Anyone, just tell me. Grade 1 mein what do you see? Yes, grade 1 mein you will see open and closed comedones, which we have already seen. Grade 2 mein what do you see? Grade 2 mein you will see papules. Grade 3 mein what will you see? So should I write it over here? 1 mein you will see comedones. 2 may you will see papules. 3 may you will see pustules. Absolutely correct. And 4 may you will see nodulocystic acne. Absolutely correct. About acne, guys, you need to know each and everything. You just cannot go wrong in acne because this is one of the most important topics that they will ask you in exam. Okay. All right. Now moving on to our next picture. So these are grades of acne. You can study it later. Identify this. Very good. Rhinophyma, or this is also commonly called as, what is it also commonly called? If they give you in the exam, it is also called as potato nose. Absolutely correct. It's looking like a batata or a potato. Now, what is the cause of this rhinophyma? Anyone? It is due to sebaceous gland. No, it is not because of blocked ducts. Okay, it is basically because of the blockage, the sebaceous glands are getting hypertrophied. Okay, so it is sebaceous gland hypertrophy. All right, next picture. Okay, now tell me guys, is this paronychia or is this onycholysis? Is this paronychia or is this onychomycosis? Yes, absolutely correct. If the skin around the nail as you can see over here is okay, but in the nail bed you have an infection. So around the skin, in the nail bed there is an infection. So this is paronychia. Okay, around the nail. So paronychia. Okay, what is the most common cause of paronychia? What is the organism that most commonly causes this infection? Yes, it's super duper painful. So it is Staph aureus. Okay, what is the treatment for this if Staph aureus is causing it? It is drainage. You have to take a small stab incision, drainage, and also give antibiotics. All right. Now tell me, they may give you a case-based scenario like this. There is a person, there is a housemaid who keeps washing clothes. So because of detergent, she is getting paronychia. In this case, what is the most common cause? Yes, very good, Aruba. In this case, it is candida. Okay. So in this case, your drainage and antibiotics, drainage will work, antibiotics will not work. You will have to give antifungal agents to the patient. Okay. So read the question carefully. Paronychia may most common cause overall is Staph aureus, but if it is because of cloth washing, detergents, then it is candida. Okay. All right. Now what is this? Now here the nail is damaged. The nail bed ko kuch nahi hua hai. Nail is damaged over here. So what is this? Yes, this is nail infection, or this is also commonly called as onychomycosis. Okay, what is the most common cause of onychomycosis? Yes, so your dermatophytes are the most common cause of onychomycosis. And what is it? It is Tinea unguium. Tinea unguium. And what is the treatment for this? So you can use nail lacquers, you can use itraconazole again because it is an antifungal agent, and you can also use terbinafine ointment. Okay, so all these are treatments of onychomycosis. So I think we have surpassed our 30 minutes. It's 33 minutes now. We will have a session 2 of this, but that will be day after tomorrow at the same time, 8:15. Tomorrow at 8 o'clock, we are going to be having a YouTube session, and in that we are going to be interviewing the INI-CET rank 9 of this year, Dr. Akanksha. So we will be asking her strategy, how she has prepared, what are the tips and tricks she would like to give us. She is one of my juniors. So we are going to be discussing with her. So I hope to see all of you on the YouTube channel. You can come and ask her. It's a live session. You can come and ask her all the questions. Okay. whatever you guys want to ask. And it's, in fact, she has studied during her internship only, so she'll be able to guide you well. So quickly showing everything. This is seborrheic dermatitis. Then we have the different layers of the epidermis and the dermis. Then these are lines of Langer. These are Blaschko's line. This is trichotillomania. This is Tinea capitis, black dot and gray patch type. This is moth-eaten alopecia. Then this is post-chemotherapy anagen effluvium. Then this is post-infection telogen effluvium. Then this is male and female pattern baldness. This scarring alopecia seen in DLE. This is perifollicular blue-gray discoloration seen in lichen planus. This is Miliaria. Then we have apocrine miliaria, that is phosphodiosis disease. Then we have hidradenitis suppurativa. We have ectopic sebaceous glands in the form of Montgomery glands, phosphodiosis spots, Tyson's glands, and meibomian glands. Then this is example of Wood's lamp, and all the colors you see under Wood's lamp. This is example of 10% KOH mount, spaghetti and meatball appearance, and copper penny bodies. Zanck smear, you see two things in Zanck smear: Zanck cells in pemphigus and multinucleated giant cells in VZV infection. Then this is liquid nitrogen. Then we have the grades of acne: comedones, followed by papules, followed by pustules, followed by nodulocystic acne. This is rhinophyma, a potato tumor of the nose. This is infection of the skin or the nail bed. So that is paronychia, and this is infection of the nail, that is called as onychomycosis. Okay, we'll have part 2 of this day after tomorrow at 8:15 p.m. and tomorrow 8:15 p.m. sorry 8 p.m. exactly on YouTube. We will be discussing with Dr. Akanksha how she has prepared and how she has excelled the INI-CET exam. All right. So thank you so much, and I will see you tomorrow. Today at 10 p.m. we have an orthopedic X-ray quiz on YouTube. Okay, 10 p.m. I am leaving the link for that on my Telegram group. Those who are not on my Telegram group, the ID is ACE NEET PG with Dr. Jhanvii, ACE PG with Dr. Jhanvii. So you guys can join it, and I keep posting the class links over there. All right. Thank you so much and see you. Bye bye.